Good evening, and thank you everyone for joining in. I, Neha Kaul, Manager Technical Development at GBCI India, will be your host for the event today. And I would like to begin by extending a very warm welcome to all the panelists and the attendees. We'll now be starting with the webinar. So GBCI India and St. Gobain Research India conducted a joint study, Healthy Workplaces for Healthier People, to understand the status of indoor environment in Indian offices and their impact on people who work in these buildings. We published the study findings last month. I'm sharing the link for the same in the chat section for all of you to go through after the webinar. We'll open the session today with a keynote address from Mrs. Millie Majumdar, Managing Director, GBCI India, and Senior Vice President, US Green Building Council, and a keynote address from Mr. Unni Krishnan, Managing Director, St. Gobain India Private Limited. This will be followed by a detailed presentation by my colleague Pooja Shukla, Senior Director, GBCI India, sharing the insights of the study with all of us. Your feedback and questions are important to us, and we would love to answer them all in the Q&A session at the end of the webinar. I would hence request you all to make use of the Q&A option on your screen and avoid posting questions in the chat section so that we don't lose sight of them. I would now request Mrs. Millie Majumdar to address us all.
Thank you, Neha. Thank you, everyone, for joining. Thank you, Unni, for joining us this evening from St. Gobain. Sorry, I'm calling you Unni because I know you for very long, Mr. Unni Krishnan from St. Gobain. Thank you all. And this webinar actually is very, very critical and important for us as many of us again have gone back to homes to start working from home again, though we had, I think, temporarily begun to, see our office spaces. So during this uncertain times, I think we are all intrigued with the question that how healthy are the spaces that we occupy, and particularly when we are now confined indoors most of the time, our mental, physical health and well-being is of utmost importance. So with this, with this understanding in mind, and in order to delve deeper into this whole question, GBCI India, with support of SGRI, had launched a study a couple of years back. And we did a primary research on a few office buildings, and my colleague Pooja will talk to you in more detail about the study to find out that whether the offices spread across the country, and many of them are green certified offices or green buildings in general, to figure out whether they are operating as per the defined indoor environmental conditions that is required for optimum health and productivity of people. So it was a study done to do that, to find out, and also to find out whether people inside these spaces are aware that they are, what is their, how important is indoor environmental quality and its influence on their health and productivity. So we did this research to find out these parameters, and the study findings we launched a few weeks back. And today we are going to discuss about that, in detail. But one thing was very important, finding that though we design many buildings to be green, and during the design stage, we follow these design parameters, but often we find that during maintenance, many of these things fall apart. And so it's very important that continuity of green performance should be there and should be measured, monitored regularly. And we are going to, find out what are the causes for these failures of maintaining indoor environmental quality and what kind of impacts it has on health and productivity of people. I hope that this study finding shall encourage more and more office management to conduct similar evaluation, which we have done for the select representative office. And we cannot also thank enough SGRI for helping us to do this very important study. And we hope also to continue this work in future with more detailed research. Thank you, and over to you, Neha.
Thank you, Millie. I would now request Mr. Unni Krishnan to address us all.
Thank you, Neha. Good evening, everyone. And first of all, a very happy new year to all of you. And I hope all of you are safe and healthy. This study on health and well-being in workspaces couldn't have come at a better time, as the world is really grappling with this pandemic, and also the dilemma on effectiveness and practicality of whether work from home or work from office. So at the outset, I really want to compliment GBCI and the Gobain Research India teams for a very meticulous, detailed and painstaking work on measurement, surveys and data analysis to bring out this paper titled Healthy Workspaces for Healthier People. It clearly brings out several opportunities for key stakeholders in the space, be it architects, interior designers, contractors, developers, corporate companies owning and occupying office spaces, facility managers, building materials manufacturers, service providers, and most importantly, the occupants themselves. There is clearly a need to recognize and also sensitize that many of our built spaces could be much better in terms of indoor air quality, could be spaces to promote health and well-being. I see, therefore, huge scope in terms of design, choice of materials, type of construction that can foster a more healthier built environment for our workspaces. At Saint-Gobain, our very purpose is to make the world a better home for everyone. And this is an important step, therefore, in that direction for us. We would be more than happy to work with GBCI as well as other stakeholders on solutions to make our workspaces healthier and also to ensure well-being for all our colleagues. Once again, congratulations to the team that worked on this, Pooja, Vinay and team under the able guidance of Mrs. Millie Majumdar, Narendra earlier and then subsequently Loic from SGRI. I also wish the team all the best to take this message and the possible solutions with key stakeholders forward in the coming days. Thank you and all the best.
Thank you, Mr. Unni Krishnan. Thanks for the motivation to keep the team going. And I would now request my colleague Pooja Shukla to take over through the findings of the study.
Thank you, Neha. Hello, everyone, and thank you so much for joining us today. So, we've had a background from about the study and why we did it from Millie and Mr. Unni Krishnan. So I will straight away jump on to the presentation. Right. So, when we are inside buildings, our body is constantly interacting with the indoor environment created by the building. So the air we breathe, the light we are exposed to, the sound we hear, all of this affects our physical and mental health. And the quality of this indoor environment is determined by the design of the space, the systems, the materials installed, and the operation and maintenance practices followed. And a healthy building will create a safe and a comfortable indoor space and also protect you from external contaminants. However, how many of us are really sure that the spaces where we are spending most of our time are really healthy? So the main idea behind this study was to document the indoor environment status in Indian offices and understand its impact on the occupants. We wanted to see how comfortable and healthy these offices are where people work, and in what ways this indoor environment is affecting them, and also to identify the avenues for improvement. So we studied 30 offices which were located in 9 cities, and this was a mix of both certified and non-certified spaces. Collectively, these buildings had these offices had an occupancy of around 30,000 people, and about 1,500 of those occupants participated in the study survey. We try to collect as much data as available on the design and operational performance of these buildings and their systems, occupants' feedback about the space, and also some basic information related to their health and lifestyle. So these data points were gathered in different ways, from the project teams through questionnaires like the one you see on the screen right now, then through site visits and spot measurements, from which were conducted over a period of 2 days on each site. And we also collected data directly from the people who were sitting in these spaces, through online surveys. And we ensured that no personally identifiable information was captured in these surveys to maintain the anonymity of the respondents, and also to encourage them to share their feedback without any inhibition. And finally, all of this data was analyzed to arrive at the results. So I'll be sharing the findings about the status of the indoor environment and our observations on what was working and what was not working in terms of maintaining a healthy and comfortable office space. So what you see on the screen are the different indoor parameters that we investigated through measurements and on-site inspection. So as you can see, for acoustics, we took measurements for sound pressure level, which is basically to assess the noise disturbance from outside, reverberation time to check the echo within the space, the noise criteria. This is a metric to evaluate, the background noise generated within from the indoor sources like HVAC equipment, etc. For thermal comfort, we took measurements for air temperature, relative humidity, air velocity, and mean radiant temperature. For indoor air quality, we took both outdoor and indoor measurements for particulate matter, nitrogen dioxide, carbon dioxide, carbon monoxide, and indoor measurements for formaldehyde and PVOC. For lighting, we took measurements for illuminance and equivalent melanopic lux. And finally, access to outdoor views from the workstations were also analyzed. So now coming to the main, the findings of the study. So overall, the findings show that there is a huge scope of improvement in Indian offices when it comes to maintaining a healthy environment. In case of indoor air quality, we found that there was only one office out of the 30 which was maintaining the indoor air parameters within the levels recommended by the standard. And both the indoor generated pollutants and those that enter from outdoors are a concern. And as you can see in this graph here, CO2 was the most non-compliant parameter. 22 spaces did not comply with the standard, and followed by NO2, PM10, and then formaldehyde and PM2.5. So, CO2 levels are generally used to evaluate the ventilation adequacy of any space. And we found that in 22 of the spaces, levels were higher than the recommended threshold, which indicates inadequate ventilation. And studies show that CO2 concentrations of 1400 and ppm and higher can actually reduce the decision-making ability of humans by 25%, and the ability to do complex strategic thinking by about 50%. And as you can see in this graph, in some of the case studies, we actually found levels ranging between 1500 to 2000 ppm in some of the spaces. And the main reason we found behind this was poor O&M, and in some cases also non-operational ventilation system. So what happened was, because of poor maintenance, the air filters got choked because of dust, which resulted in reduced fresh air intake. And in some cases, we saw that due to high outdoor air pollution, the building operators shut off the outdoor air intake to reduce the entry of outdoor pollutants inside the space. And this led to buildup of indoor pollutants. Now, in this current pandemic scenario, proper ventilation of enclosed spaces is very crucial. And therefore, it's a must that buildings should take measures to correct insufficient ventilation, as it is very crucial for the safety of the occupants. Now, in terms of good practices, we found that CO2 sensor-based fresh air intake was a very effective strategy in ensuring proper ventilation. So you can see here some of these case studies, some of these bars that you see here, which are highlighted, which have a thicker outline, they had CO2 sensors installed, and all of them had CO2 levels lower than what is recommended. So which is good. They were able to maintain the levels as desired. Now, when evaluating how prepared the buildings were to filter outdoor air pollutants, we found that 20 out of 30 cases had nitrogen dioxide levels higher than the threshold. Now, NO2 from outdoor traffic was entering the spaces through ventilation and infiltration, as chemical filters, which can remove the gases like NO2 from outdoor air, was present in only 3 of the spaces that we studied. Again, in case of particulate matter, we found that 63% cases had high levels, and 40% spaces did not have fine filters installed for filtering fine particles like PM 2.5. For evaluating lighting environment, we examined 3 parameters: illuminance, equivalent melanopic lux, and access to good quality outdoor views. So the findings of the lighting, the lighting measurements were quite surprising for us, because we saw that 64% of the spaces had illuminance level lower than what is recommended. In fact, in some of the spaces, the lux levels on workstations were lower than even 100 lux, which is 1/3 of what is recommended. And what was very surprising was that we observed that in many spaces, even when the daylight levels inside the spaces were very low, people did not switch on the artificial lights and continued to work in low lighting conditions for most of the day without complaining. And in 15 of these 19 spaces which had low levels, all the artificial lights were not switched on. And some of these spaces even had provision for task lighting, but they were not being used. Now, this shows that people are unable to notice poor lighting as their eyes get adjusted to low lighting conditions. However, this does have an impact on their eye health, which I will be talking about later. These issues highlight the need for better lighting controls and integrating lighting sensors to ensure that adequate lighting levels are maintained inside the spaces throughout the day. Now, along with illuminance, we also measured the equivalent melanopic lux or EML levels in these offices during the morning hours, so between 9 a.m. and 1 p.m. So EML is a metric to measure the circadian effectiveness of lighting. In addition to helping us see, light also has many non-visual effects on human body. It affects our circadian rhythm, which controls several physiological processes in our body, like our sleep-wake cycle, blood pressure, metabolism, etc., and thereby affecting our alertness, digestion, sleep. Now, therefore, the lighting environments that we are exposed to throughout the day has a very important role in influencing our overall health. And however, from our measurements, we found that only 3 spaces out of the 30 met the recommended EML threshold. Daylight actually has the highest level of light to which the human body circadian system is most sensitive. However, from our observations, in most of the spaces, we saw that they did not have adequate daylight indoors due to various design and operational factors. In fact, I'll share with you, a common operational issue that we saw in many offices. So offices which had manually operated blind systems, we saw that once, even though the glare from window was only there for a specific duration, once they would roll down the blind would stay closed for the entire day, thereby significantly reducing the daylight penetration inside the space. Access to quality views from the workstations was another concern, as 74% of the occupants reported either no external view or poor quality view from their workstations. And a very interesting and important finding of the study is that lack of access to quality views was found to be directly related to how occupants feel at the end of the day. So, people who reported having a good view of the outdoors had higher energy levels at the end of the day than those with poor or no views. As you can see here in this graph, people who reported that they had a good view from their workstation, 40% of those were energetic, felt energetic at the end of the day, compared to just 8, 11, and 7% of people who did not have a good view or had a poor view from their workstation. So these findings emphasize the importance of interior layout planning and also well-designed windows with proper glazing to ensure a high quality lighting environment that maximizes both access to outdoor views and daylight. Thermal comfort conditions were as per the standard in 75% of the office spaces. However, we observed that in most buildings, the thermal conditions were controlled centrally by the BMS. So only a few spaces gave complete control to the occupants to modify thermal settings. This led to overcooled or undercooled spaces and resulted in occupant discomfort. And interestingly, when we analyze the occupants' feedback about thermal comfort conditions, we found that occupants preferred slightly warmer spaces. However, our measurement showed that 56% of the spaces were operating on the cooler side of the comfort zone. So, this is, this shows that if the buildings are operated on the warmer side of the comfort zone, it will not only keep the occupants happy, but also result in significant energy savings. For acoustics, we found that buildings performed well in reducing the outdoor noise and reverberation time. However, interior background noise levels were higher than the threshold in 73% spaces. And when we analyze the interior finishes with respect to space acoustic performance, it showed us that ceilings with acoustic tiles performed best in optimizing reverberation time, and offices that had drywall partitions had lower background noise compared to spaces with MDF board or hard surface partitions. So as Millie mentioned in her speech, when we compared the performance of certified versus non-certified buildings, this showed that even though certified spaces were designed better, they were unable to deliver a high quality indoor environment. And one of the main reasons we found behind this gap in design and performance was poor equipment operation and maintenance. This study has very clearly brought out that maintaining a high quality, healthy and comfortable space is a continuous process. And getting a green building certification is just the first step. But to realize the health benefits of green certification, the project team has to ensure that, in addition to ensuring that at the certification stage, they should utilize all the key strategies that will deliver healthy indoor environment later on. But in addition to that, they should also follow appropriate operation and maintenance practices and regularly track building performance, which is very crucial to ensure that your building is delivering what it has been designed for. Now, understanding how the indoor environment impacts the people and how these people felt about their office space was a very critical component of this study. So, as part of the study survey, the office workers were asked to provide a feedback on their satisfaction levels with the different indoor aspects. And we found that people's perception about the space did not really align with the actual measured IEQ status of the space. So despite poor lighting and air quality that was observed in most case studies, 76% of the occupants reported satisfaction with lighting and 68% with the air quality. This shows that, the occupant's perception alone cannot be the basis for evaluating how healthy or, what is the status of your indoor environment, because this should be always supplemented with regular measurements and monitoring. Now, study has helped us in identifying indoor factors that impacts occupants the most. So as you can see here, high levels of nitrogen dioxide in the indoor air, lack of access to good outdoor views, and low melanopic lux level exposure in the morning hours were the top factors affecting people's overall happiness with their office environment. And these factors are also negatively impacting the productivity of the occupants. And occupants felt fatigued at the end of the day due to lack of access to good outdoor views, poor thermal comfort conditions, and high levels of noise generated indoors due to HVAC and other equipment. Now, these findings are very important because it pinpoints the factors which play a very important role in how occupants are really feeling about the space, and how, which factors need to be really maintained at an adequate level, at optimum level, to ensure that people feel, healthy, comfortable, and most productive while they're working in their offices. Also, as part of the study, we attempted to get a snapshot of occupants' health, lifestyle, and workplace habits by analyzing the data captured through the online survey, and also to identify the potential opportunities for improvements at the workplace that can, encourage people to lead a more healthier lifestyle. So we asked people in our online survey, we asked them that if they had experienced any symptoms related to eye health, musculoskeletal pain, or any health issues related to poor air quality. So we found that 60% of the respondents reported eye health problems like eye strain, dry eyes, fatigue, blurry vision. And eye strain was the main eye problem reported by 27% of the people, as you can see in this pie chart here. And improper lighting conditions like low illuminance, glare, and non-uniform lighting, which was observed in many of the case studies, can actually cause visual discomfort, which leads to these eye problems. And 45% of the survey respondents reported experiencing symptoms like fatigue, dizziness, and coughing, which can be due to poor indoor air quality, again observed inside many of the offices. Study data revealed that prolonged sitting is prevalent amongst occupants. 64% people reported sitting for 8 to 10 hours daily at their workstations, and only 19% took a break every hour. So, for your information, it's recommended that if you're sitting for a long time, it's very important that you take a break every 1 hour to just, change your position, do a little bit of stretching, just to break that long seating duration. And not surprisingly, 66% of the surveyed occupants reported musculoskeletal issues. So the study data has showed us that prolonged sitting coupled with infrequent breaks results in increase in musculoskeletal issues like problems like neck pain, shoulder pain, wrist pain, and back pain. Yeah, that was one of the common issues reported. And also eye health problems like dry eyes and eye irritation. So about the health, basic, some lifestyle related health issues, we asked people to report if they had faced any of these issues in the past 1 year. And 44% of the survey respondents reported that they were facing one or more of lifestyle related health issues like obesity, high blood pressure, high cholesterol levels, and diabetes in the past 1 year. And data showed that 53% people who responded to the survey were in the overweight or obese category. And, considering that 90%, almost 90% of the survey respondents were below the age of 45. So these data points indicate a very worrisome trend, of unhealthy lifestyle amongst the young working population of India. Study data showed us that 71% respondents were getting less than 7 hours of average daily sleep, and 37% occupants reported facing sleep-related problems. And also, reports of lifestyle-related diseases were 23% higher from occupants with sleep-related issues as compared to those with no sleep issues. This was a very interesting finding. When we correlated what people reported with respect to access to views with reports of sleep problems, we found that lack of access to quality views had a connection with people's sleep quality. So people who reported having a good view to the outdoors reported lesser sleep-related problems compared to those which had, who had poor or no views, as you can see here in this graph. And, this indicates the significant role external views from what you see from your workstation, the importance of that in enhancing your health, and particularly mental and mental health and well-being of the people. Intake of fresh fruits and vegetables was found to be very low, and there was a direct correlation found between the fresh fruits and vegetables intake and reports of incidences of lifestyle diseases. Study data indicated that most of the surveyed occupants were getting some form of exercise. However, only 34% people reported doing vigorous physical exercise. So, the data showed us that most people reported that they were walking, some amount of walking they were doing. And when we investigated this information in detail, we found that those engaging in vigorous activities had lesser incidences of lifestyle diseases compared to those who did moderate activities or did not perform any physical activity. So, as you can see in this graph here, it's so clear, how, the reports of lifestyle diseases, how they increase as the type of activity one is doing changes. So, while, any form of exercise is good for health, it is important to educate people on the type and duration of physical activity required for a healthy lifestyle. And also amenities can be provided at the workspace, and policies at workplace can encourage fitness amongst the workers. here on the slide, you see some examples of how workplace interventions that can encourage office workers to lead a healthier lifestyle. For example, educating people on the importance of healthy diet, provision of amenities that encourage people to be more active, workplace policies on regular health checkups for the staff, discouraging sale of junk food on the premises, and so on. So, this study has revealed some very critical issues that are prevalent in Indian offices and that need to be addressed. And it also lays out a path that can be easily adopted by any office to evaluate and improve their health performance. So, it's just a matter of creating awareness amongst the people and the building managers, doing evaluation of the space, and whatever factors which are cause of concern are identified, corrective action should be taken. Regular monitoring of the building's IQ performance, and also taking feedback from the occupants on their perception. And again, introducing workplace interventions that encourage a healthier lifestyle amongst people. So all of this can result in a space where people, where you're not just working, but it's also having a positive impact on how your overall health and lifestyle is. It also encourages you and promotes a healthier lifestyle amongst the workers. And of course, it also affects and positively impacts your work performance. And again, in the current scenario, COVID-19 pandemic has put a spotlight on workplace health and safety. And the expectations from the workplace are certainly going to change in the post-pandemic world. So we really hope that the study findings will help businesses and building owners across India to bring about a positive change in the workplaces and make them healthier for the occupants. So these are the advisors for the study who guided us throughout the study duration: Dr. T.K. Joshi, Dr. Bishwadeep Paul, Ms. Kelly Warden, and Mr. Jean-Marie Thuvin. And I would like to mention that Dr. Joshi and Dr. Paul are medical doctors and occupational health experts. So they provided us their feedback, on the medical aspects of the study. So we are very thankful for their guidance throughout the study. And that brings us to the end of the webinar. And we can now open the session for question and answers.
Thank you, Pooja. This was really informative. We have some questions coming in. So I'll just read out the question to you and you may take it up. So first is, what kind of standards have been looked at while assessing the office environment?
Okay, so we looked at, for most of the parameters, we referred to ISHRE IEQ standard, Class A building, that was referenced. And also for lighting, we referred IES lighting handbook. And also, in the white paper that has been published, so in that, all the list of standards that have been referenced, you can find a list of that in that appendix. So Neha has, I think, already shared a link to the document in the chat box. So you are welcome to download the document and see that.
Sure, Pooja. Thank you. And there's another question coming in. It says the acoustic challenges were more prominent for any specific areas in the office as per the study, like open office, conference rooms, cafeteria, etc.
Yes, that's a great question, actually. So yes, we found that mostly it was in the open office areas that these acoustic problems were there. And like I mentioned, most spaces had the issue of high interior background noise levels. And that was primarily because of the proximity of the equipment room to where the people were sitting. So because of inadequate noise isolation, the noise was actually affecting, and the noise criteria levels were high in the open office spaces. So I see another question here. Yeah, could you please tell us more about the age of buildings studied? Which year, decade were they mostly constructed in? So we did actually, I don't remember exactly which, I would say they are mostly about within 10 to 15, not more than that, 10 to 15 years old. And we also, this was a very important factor at the beginning of the study. When we had conceived the study, we wanted to also see if as the building ages, as the systems are become old, if that impacts the indoor environmental quality. But when we did the analysis, we did not really find any correlation with that. So that is why we did not include it in the final results. So we did do this analysis about the, if the age of the building, when was it built, how old the buildings and the systems were, and if it had an impact on the IQ performance, but it did not have any correlation.
Pooja, there's another question coming in. If in case we want to evaluate our office space, what can we do? Or like, can GBCI help us in any case?
Yeah, I mean, see, the white paper, the study has very clearly laid out a process that offices can follow. It gives a broad guidance on how you can evaluate and improve the performance, indoor environmental performance of your space. But if you have any specific query, please do write to us, and we'll be able to guide you on that.
There's another question which has come in. Can GBCI or any entity help influence the NBC standards, which are not very thorough, especially for concerns like room acoustics?
Okay, Millie, would you like to answer this?
Yes, so NBC primarily is it's a supporting document that influences building codes, and also it's a good practice document, and it has a specific coverage. We can certainly, and ISHRE document is there that is also used as a supporting document whenever NBC gets revised. So I think, in a combination along with NBC, the other standards also should be used, because only one standard cannot address each and every parameter in so much of detail. There are supporting standards, and NBC, what it does is that it references relevant standards from time to time, as and when they're available.
Yes, thank you. I mean, with Millie here, I thought it was more appropriate for you to answer that question about NBC.
Because in NBC, there is one chapter 11, which we wrote, when Dr. Jain was also there, he kind of guided that chapter development, and I was also one of the authors. So that time, all of us pulled in different sections from different relevance codes and standards, including ISHRE document, including ECBC, etc., to make it more comprehensive. But then you can go into, so much of detail only in such a vast scope.
Yes, thank you, Millie. I see another question here. Thank you for using ISHRE IQ document. Did your parameters like PM, TVOC, CO2, NO2 vary during the course of the day and had any seasonal variations? If yes, when these readings were good, worst? Right, so that's a great question. So yes, we did take measurements for each of these parameters. We took measurements throughout the day. For example, and like I said, both indoor and outdoor were required. For example, for CO2, we took, continuous measurement, at different times of the day, because CO2 levels rise as, people are sitting, and if the ventilation is not adequate, then they will keep on rising. So that is why we took measurements at different times of the day. And for each of these, we found they were following different trends. So, I mean, it's very difficult to get into each of that, but yes, it depends a lot. For example, particulate matter, it depends on a lot on what was, when the measurements were taken. So if the outdoor pollution levels are very high at that time, and if the building had shut off their, in some cases, like we found, if they had shut off their level, their fresh air intake, then the levels were, initially higher and then they were stagnant. But in cases where there was proper ventilation and filtration, we saw that levels would, in the beginning be maybe a little high, but then they stabilized and came within the healthy levels, came down to the healthy levels. So it varied. Again, for NO2, it depended, because it was mostly the traffic pollution which was entering and causing the high indoor levels. So that also depended on which floor the building was. I mean, just adding to another variable which was there. And also during the day, sometimes in the morning the levels were lower, and in the evening the levels were higher, of course, because of higher traffic. So we did all of that evaluation, indoor, outdoor, at different times of day, and then arrived at a number which kind of took care of everything and covered all these variables. I hope I answered the question.
There's it's not a question, it's more like a comment from one of the attendees. It says most offices use Venetian blinds in office that restricts outside view, which can be avoided.
Yes, absolutely. The study has clearly shown, if we are using a device for glare control, its operation is very important. I mean, you need to ensure that it's down only when there is glare discomfort and not all the time. So usually it's a manual problem, because once you roll down the blinds, you just forget to, roll it back. So that is the issue. So that needs to be monitored and ensure that it's done properly.
There is another broad question which has come up, like, what do you plan next with the findings of the study, or how do you plan to take it forward, whatever findings have come in from the study?
And that's a great question. This study has identified some very critical parameters that impact indoor environmental quality. And we want to now, as a next phase, in fact, we are planning the next phase of the study, and we will be launching it very soon. And in this phase, we want to do an in-depth analysis of how these indoor parameters actually, we want to quantify the impact these indoor parameters have on the occupants' health and productivity. So that is where we want to, that is the next step we want to take and build upon the study findings that we have in this phase. I see a question here, Neha. The CO2 measurements indicated were alarming. Could you confirm if the readings were done after COVID hit, after Feb 2020? No, the readings were taken before, I think, March 2020. Yes, all the readings were done before March 2020. And anyways, I mean, just to clarify here, so, the CO2, no, sorry, that's fine. I think I read it wrong. Yeah, so the readings were taken, all the readings were taken before March 2020. There's another question. Did these parameters, sorry, go ahead,
Pooja, I mean, there is, so I also could not understand the relevance of COVID hit conditions here, because whatever the buildings adapted to, that had really no correlation with the CO2 measures being altered due to COVID. So if there is any specific thing that you need to know, you can please reach out to us. But I'm not seeing any direct correlation with the COVID situation. Yeah.
I think maybe because everything was shut down, so of course there were almost no people in the offices.
No,
but yeah.
Yes, of course. But we did, I mean, to answer that, then we did the measurements when the buildings were occupied, and the
fully
systems
occupied. Yes.
Yeah.
Yes. We ensured that, buildings had full occupancy when we took the measurements, to ensure that the measurements were correct. There's another continuous, the question that was earlier there about the air parameters. So there's a question again, were these parameters high towards the evening as compared to morning or afternoon? So yes, like I said, it varied. For CO2, the levels were higher as towards the evening, and for other parameters, it varied from building to building. So yeah, it did not follow any specific trend that can be generalized for all the cases. I don't see any more questions, Neha. So maybe there's one more question. Regarding the findings of people preferring slightly warmer, colder, how was the data collected? Might have answered. The respondents might have answered considering their environment at the time of filling the survey. For example, if in office, respondent might answer warmer, or if the person was at home during peak summer, would have answered cooler environment. So no, all the, like I said, the measurements were taken in the office spaces. So people these were all people sitting inside the offices and inside their workspaces and responding to the questions. So nobody was sitting at home and responding. So it was the measure, the data, and also the data was collected throughout the year. So in some cases it was during summer, some cases it was during winter. So it varied. It covered all the seasons.
Just to add to what Pooja said, besides data being covered through the survey, there was on-spot measurement also happening to collate the findings. There's someone asking if you can share the format of the questionnaire.
Format of the questionnaire. So, okay, please, you can get in touch with me. I'll have to, check and revert back to you.
Any closing comments?
No, thank you, everyone. And, this study has been great. It was a great journey because, when we started, the idea of the study came a couple of years back. And I think it started with that initial discussion between me and Vinay trying to convince each other to work out the methodology. And this is where we are now. And I think the study findings are very relevant now and very useful. They are going to be very useful. And I really hope that offices are able to, apply these in their spaces and ensure that in this current situation, the spaces are healthier and occupants are confident about the safety and health performance of their spaces, their workspaces, and they are not, they don't have any concern to resume work from office. So I hope the study helps businesses and offices across the country for this.
And I also think, the methodology is a prototype that we have developed, which is very much replicable for other types of buildings like hospitals, schools, residences, and the findings may be different. The correlations may be different, solutions may be different. So it's a pretty much replicable and expandable study also in that form.
All right, then. Thank you, everyone, for your time today. It was a really informative session. And in case you have any questions post the session, please feel free to reach out to Pooja or anyone from the team. Have a great day ahead.